They voted red. They trusted Trump. But now, in counties across Kansas and Missouri, the last open hospital is shutting down. Ambulances reroute patients over 70 miles away. Maternity wards are gone. And some towns, the only ER has turned into a storage unit. Since 2010, 193 rural hospitals have closed across America. Now, a new Republican bill threatens to erase dozens more. And the people who cheered for the cuts, they're the ones bleeding out. The One Big Beautiful Bill Act was supposed to fix healthcare waste. Instead, it slashes over $700 billion from Medicaid over the next decade. New work requirements mean 4.8 million Americans could lose their coverage. These include working-class families, veterans, and people struggling with chronic illness. If you don't report 20 hours of work per week, no coverage. And it doesn't stop there. The bill also caps state provider taxes, a lifeline used by states like Kansas and Missouri to fund their rural hospitals. No taxes, no match funding, no Medicaid payments. This is why 63 rural hospitals in Kansas alone are now at risk of closing, including 26 that experts say could shut down immediately. At Capital Regional Medical Center in Jefferson City, Missouri, Dr. Rothermich says they already can't fill night shifts. 3 doctors cover 40,000 people while doing 5 jobs at once. And now, the GOP bill pulls out the last financial pillar holding them up. Hospitals aren't just buildings. In towns like these, they're the only lifeline left. This isn't just about poor patients losing coverage. It's about a chain reaction that hits every American, especially those with jobs and private insurance. When rural hospitals close, they leave behind billions in unpaid care. In 2026 alone, experts project $31.9 billion in lost rural hospital revenue and $6.3 billion in uncompensated care. Treatment hospitals must provide, but never get paid for. To survive, hospitals shift those losses onto private insurers, and insurers, they pass it to employers. Result? Average Americans see their employer-based premiums rise by up to $485 per year. That's 179 million Americans now paying more because the government refused to cover the poorest. And in Kansas, it's ground zero. 4 hospitals have already closed since 2020. 1 ER is now forced to serve 5 counties, and maternity care nearly vanished.
In 2024, 51% of U.S. rural counties had no obstetric services at all. So the next time a pregnant woman calls 911 in rural Missouri, she might not make it in time. All of this from a bill designed, sold, and celebrated as a healthcare solution. Meet Sarah Matthews, a 42-year-old mom of 2 in rural Missouri. For years, she battled PTSD and depression after escaping domestic abuse. She finally stabilized thanks to Medicaid, therapy, medication, support. Her children say, "We got our mom back." But under the GOP's new work rules, Sarah would lose coverage unless she works 20 hours per week, even though her doctor says she's not mentally fit for full-time employment. She's not alone. Over 1.7 million low-income parents like Sarah face the same cliff. Most live in red states, many already work part-time or care for disabled family members. And if they lose coverage, they lose meds, therapy, checkups, and their ability to function. Meanwhile, hospitals prepare for a storm of uninsured patients. Karen White, CEO of a rural hospital in Missouri, warns, "We'll see loss of life, not right away, but over months. A missed dose here, a crisis unhandled there. Mental illness, diabetes, pregnancy complications. These aren't later problems, they're now." And here's the kicker. Most people affected aren't jobless. They're the working poor, just without a printer, or stable hours, or childcare. But in the eyes of this law, they don't count. Now, the bill faces a final showdown in the Senate. Some Republican moderates are wavering. Senator Susan Collins has demanded a $100 billion rural hospital bailout just to consider voting yes. But Senate Whip John Thune replied, "We can't go that high. It'll blow the budget." So the GOP offered $15 billion. That's less than half a year of losses projected by rural hospitals. It's a Band-Aid on a severed artery. And while Congress argues over spreadsheets, real hospitals are shutting their doors. In Kansas, entire counties now have no emergency room. In Missouri, some towns have no delivery ward within 90 miles. Pregnant women must plan C-sections based on ambulance availability. Stroke victims die in transit. These aren't hypotheticals. They're happening right now. The same bill that promises choice and freedom is stripping people of both. And in the places hit hardest, rural, conservative, aging communities, the silence is deafening.
Let's be clear. This was never just about cutting waste. There's a deeper playbook at work here. It starts with shrinking Medicaid, $700 billion in cuts over 10 years, quietly buried inside the GOP bill. As federal money dries up, rural hospitals buckle under pressure. 193 hospitals have already closed since 2010, and experts say over 300 more are now at immediate risk. When a hospital closes, it doesn't just disappear. It becomes a bargain. Private equity firms are moving in, buying up distressed facilities for cents on the dollar. They cut staff, scale back services, and rebrand emergency rooms into profit-first urgent care centers. And while communities lose access, insurers take advantage. With fewer hospitals competing, insurance premiums climb, and so do profits. Middle-class families are left holding the bill. Meanwhile, Washington steps back. No more safety nets, they say. Let the market fix it. But markets don't rescue heart attack victims. They don't rush to deliver babies when the closest delivery room is 90 miles away. They don't staff ICUs in towns of 8,000 people. What's happening isn't just deregulation. It's a transfer of power from public health to private profit. And on Wall Street, the investors are watching. Firms are already positioning themselves to dominate rural healthcare as closures accelerate. All while the people who paid into the system are now locked out of it. So let's go back. They voted for Trump. They believed in conservative values, self-reliance, smaller government, fiscal discipline. But now, their hospitals are gone. Their premiums are rising. And when their parents collapse, 911 sends them 90 miles away, if at all. This isn't a failure of policy. It's a choice. A trade. $700 billion cut from Medicaid to fund tax breaks, defense hikes, and political wins. And the people who trusted the plan? They're left with promises and parking lots where emergency rooms used to be. So let's go back. Ask yourself, when the next crisis hits, when it's your child or parent or neighbor, will someone be there? Or will the system say, you didn't qualify?